Hey Dre, so here's a little walkthrough of a shoulder scope like you and I discussed. So whether or not we're doing a left or right shoulder, doesn't matter. We're always going to enter through a posterior portal with our scope. So that's going to enter the glenohumeral joint. And when we get in there, we're going to see the humeral head, the glenoid, the labrum, as well as the long head of the bicep tendon. So pulled up a couple pictures here just to kind of aid the conversation. So like I mentioned, we have the humeral head, the fibrous coating, which is the labrum here. We have the glenoid, and then you have the bicep tendon kind of running across here. Inferior to the bicep tendon, we can see the MGHL, the medial glenohumeral ligament, as well as the subscap pictured here. One important thing to note, the long head of the bicep tendon is pictured here. We can't see the short head of the bicep tendon when doing a scope like this. And both heads of the bicep originate at the radial tuberosity. And they're going to insert here, the long head is going to insert here at the superior of the labrum, more specifically the supraglenoid tubercle of the labrum. So surgeons will often probe at the long head of the bicep as well as the supraspinatus just to kind of test the health of them and kind of help aid them in how they're going to move forward with the rest of the potential procedure. So like I mentioned, inferior to the bicep, we could see the subscap here. The subscap is going to originate at the scapula and attach to the lesser tuberosity of the humerus. The subscap is going to be responsible for that internal rotation of the shoulder. So above, superior to all of this, we have the supraspinatus muscle, which is going to be responsible for raising the arm up, that abduction motion. And sticking to the analogy that you and I discussed, thinking of this as the first floor of a house, we kind of go inside. We have all of our good stuff, all of the nice furniture that you want people to see. That roof of the house, that quote unquote ceiling of the first floor, that quote unquote ceiling of the first floor is going to be the supraspinatus, which is going to be the most common tear spot. Although I have seen like one or two subscap tears, which were quickly repaired, the supraspinatus is going to be that main tear spot. And that originates at the supraspinous fossa and inserts at the greater tuberosity of the humerus. Additionally, inferior to those, we have the other two main shoulder muscles, which is going to be the teres minor and the infraspinatus. The infraspinatus starts at the infraspinatus fossa and attaches to the greater tuberosity of the humerus. And then the teres minor originates at the border of the scapula and inserts at the greater tuberosity of the humerus as well. So that kind of covers our first floor analogy and the main shoulder muscles and their anatomy. So we mentioned the MGHL kind of acting as this seatbelt coming across here, helping to keep the humeral head in place. So it'd be important to mention just the three main ligaments. So the three main ligaments that are going to make up that part of the shoulder. So we have the medial glenohumeral ligament, like we mentioned, which originates at the anterior labrum and attaches to the anterior of the humerus, which you can see here. Superior to that, we have the superior glenohumeral ligament, which originates at the superior labrum and attaches to the lesser tuberosity of the humerus. And inferior to these, we have the inferior glenohumeral ligament, which is going to originate at the inferior labrum and insert at the neck of the humerus. So that kind of covers the anatomy of our first floor of the house, as well as a little deeper in those three main ligaments. So kind of just continuing on, so moving on to that second floor of the house, we're going to have the subacromial space. So the acromion in our analogy is the quote unquote roof of the house, while now on the second floor, that floor would be the cuff. So when looking down, when in the second floor, or looking up while on the first floor, if you see a giant hole, there's likely a large cuff tear. So working within the subacromial space, it's a really common site of subacromial decompression, which we've seen quite a bit of. That's kind of the process of shaving down part of the acromion to create more space within the joint, and surgeons believe this to reduce pain. So we've seen quite a bit of those. And then moving medially kind of throughout this space, we have three ligaments that are present in the area. So we have the CA ligament, which is connecting the coracoid process to the acromion, the AC ligament, which is kind of working within this joint space here, which is connecting the acromion to the collarbone, to the clavicle. And then we also have the CC ligaments, which are connecting the coracoid process to the clavicle. So all three of these are essentially just working to provide general stability within the region. So this is going to be, like I mentioned, the spot of that subacromial decompression, as well as being able to view kind of what's going on with the upper floor of the house. I think that's a pretty good quick walkthrough, just kind of all the anatomy of both the first and second floor. And let me know what you think.